Assalamu alaikum, Dr. Nadir. Assalamu alaikum, everyone.
عليكم السلام ورحمة الله.
عليكم السلام ورحمة الله وبركاته.
Assalamu alaikum. Hello, everyone.
Hello.
So today is from team. We'll take care of the meeting. So if you are ready, go ahead. Thank you. Welcome, everyone.
Welcome, Dr. Nadir.
Hello, everyone.
Hello. Assalamu alaikum. Eid Mubarak.
Hello, alaikum assalam.
Assalamu alaikum.
Alaikum assalam.
Hello, good evening, everyone.
Hello.
Assalamu alaikum wa rahmatullah.
عليكم السلام
Salam.
ورحمة الله. I'm gonna share the screen for the agenda for today. So then you can take care of the meeting. Thank you.
Okay, so welcome everyone to the meeting. And happy Eid Mubarak for everyone who celebrated. So today is, thank you. So May 7, 2022, the Telegeriatric Research Fellowship at Michigan State University. We are the Brown team, and I'm Tahani, the leader of the team. So I think there are new fellows joined today. If you want to introduce yourself, please raise your hand and just tell about your name, where you graduated from, and where are you living now. So we get to know about you. Any new fellows joined today?
Assalamu alaikum.
Okay, just raise your hand and okay, you can go ahead, Dean Alhaji.
Okay, assalamu alaikum wa rahmatullah. My name is Dr. Dean Alhaji Al-Awad. I'm living, I graduated from University of Khartoum, Sudan, and now I'm living in New York City. Actually, I would like to send my thanks and appreciation to Dr. Nadir to give me this opportunity to be one of the members of this group. And I'm really so excited to learn and to work with all of you guys. And thank you so much for giving me this opportunity.
Welcome, Lena. Thank you. Then we have Mujtaba. Can go ahead, Mujtaba.
So, good evening or good morning, everyone. My name is Mujtaba Ahmed. I graduated in late 2016 from Azim Al University. Currently, I'm working in Riyadh, Saudi Arabia. I'm happy to be with you, and I hope it goes well for all of us. And especially, I want to thank Dr. Nadir for his time and his great work. Nice to meet you all. Thank you.
Thank you. And Muhammad Abdullah, go ahead.
Hello, good afternoon, everyone. My name is Muhammad Abdullah. I graduated from from the University of Medical Science and Technology, and I'm always interested in the research, but I don't know how to start. So this will be a valuable opportunity for me, and thank you so much for this opportunity.
Thank you, Muhammad, and welcome to our team. Then have Data, go ahead.
Hi, everyone. My name is Fathia Muhammad. I graduated from University of Jazeera back in 2014, I would say. And thank you so much, Dr. Nadir. I know it was like last chance and it was like the last day. Thank you for accepting me in the program. And I'm very happy to be with you guys.
Welcome, Fathia. Thank you.
Of course.
Then next you have Muhammad Tahir. Go ahead.
Assalamu alaikum. Good evening, good morning, everyone. Hi, my name is Muhammad Tahir. I graduated from University of Khartoum 2016. I'm really happy to be with you, and really, I would like to thank Dr. Nadir for this priceless opportunity to join this fellowship. Thank you, all of you. Nice to meet you all. And I believe this opportunity will be very important for all of us to pursue a career in research. So thank you, all of you.
Thank you, Mohammed. Welcome to our team. Then Rasha, go ahead.
Hello, sorry, I have issue in my camera. My name is Rasha Abdullah. I'm graduated from Shand University, living in New York. Thank you for this opportunity. Special thank for Dr. Nadir and the other team leaders and the staff. And I think this will be a great opportunity for us to learn about the research and help us a lot to pursue our career. Thank you.
Thank you, and welcome, Rasha. Then Msu, you did introduce yourself last week.
Hello, I'm Dr. Msu. I graduated from the National University of Sudan. I'm very grateful for this opportunity. I graduated, I currently live in Sudan and work in Sudan. And I hope we learn a lot from each other, and I hope this is going to be a good trip.
Okay, welcome, Msu. Thank you. Then Mafaz.
Good evening, everyone. My name is Mafaz. I graduated from Msu University. I would like to thank Dr. Nadir for this opportunity, and I'm glad to get to work with everyone. And thank you, Dr. Tani, in advance for the presentation. Thank you.
Thank you, Mafaz. Anyone else? Okay, thank you. And
yes,
we're so
yes.
excited to having all of you today. And anyone? Ayman?
Yes, Tahani. Maya.
Oh, okay. Hi, Maya.
Yeah, hi, Tahani. Hello, everyone. I'm Maya Advani. I graduated from People's Medical College, Pakistan, and I'm currently living in Tampa, Florida, and working on step 3 currently, and I'm going to apply for this 2023 match. Thank you so much, Dr. Nadir, for giving me such a great opportunity. This research really helps us, everyone, and thank you so much for everyone. Thank you.
Thank you, Maya. Welcome. Anyone new come today new?
Yes, this is me. My name is Ayman Muhammad. I'm graduate from Al-Fashir University, Sudan, 2012. I would like to thank Dr. Nadir about this opportunity, and I'm so happy to meet you all.
Okay, welcome, Ayman. Welcome to our team. Yeah, I hope everyone will benefit from this research. We're so excited to having all of you. Then Hussein.
I am Dr. Hassan Said. I graduated from, yes, I am Dr. Hassan Said. I graduated from Al Azhari University, currently working in Sudan. I am very happy to be with you today.
Okay, thank you, and welcome with us.
You're welcome.
Anyone new?
Yes.
Okay. If
Hello.
no,
Go ahead, Arthur.
Hello.
Yeah, go ahead.
Yeah. Hello, everybody. My name is Dr. Atif Bakir. I graduated from University of Jazeera. I want to thank you, Doc, and thanks Dr. Nadir for this great opportunity to join this team. Thank you all, guys.
Okay, thank you, Atif, and welcome. Okay, actually I cannot see everyone. Anyone else? If no one else, we can start our agenda for today. We have a Frailty presentation topic presented by Dr. Sarah Said. If you are ready, Dr. Sarah, you can go ahead, share your screen, and start your meeting. Start your presentation.
Okay.
Hello.
Yes.
Assalamu alaikum.
Walaikum salam.
Yeah, I am new for this year. My name, I want to introduce myself. My name is Shiza Hassan. I am graduated from the Islamic University. Thank you so much, Dr. Nadir, for this great opportunity and for your help. And thank you for all of you, and welcome all of you. And I'm glad to be with you. And thanks.
Welcome, Shiza. Thank you. Thank you for introducing yourself.
Thank you so much, everyone. Go ahead, Sarah.
Assalamu alaikum, Dr. Nader. Assalamu alaikum, and welcome to the new co-fellows. We are excited to have you here. Thanks to Tahani for being the team leader for us this month. We're looking forward to an exciting journey. As an old and a senior fellow here, it has been like a very exciting experience for me. I've learned a lot over the past year, and I hope all of you like enjoyed your experience like I did. Today we'll start our presentation. We're talking about the frailty. This presentation is made by the American Geriatric Society as a part of Geriatric's review series. So we'll be reviewing this together. So I would like to double check if you are all seeing the PowerPoint.
Yes.
Yes.
Okay, sounds good. Thank you. So for the frailty, okay, so have you noticed the transition of slides? Just make sure everything is smooth.
Yes. Yes.
Okay. Okay, so thank you everyone. So for the main objectives for this presentation, for this review, is to be able to describe why frailty is considered as a clinical syndrome, the clinical manifestations of frailty, and the adverse outcomes that are common in the frail patients, the most effective approaches to preventing frailty, and the principles of caring for the frail patients. What are the evidence-based findings, and what are the evidence of as to cause of frailty, how to assess for it, and the management strategies for that, and the potential approaches for preventing of frailty and failure to thrive, and how about frailty and palliative care. So what are the stressors? Excuse me. So what are the definitions of the stressors are for frailty? What are the risk factors? So stressors such as hospitalizations, surgery, illness, and other environmental extremes that are less tolerated by the frail older adults. So the frail older adults are more likely to have, and they are at increased risk for having delayed recovery from illness or even from fall. And they have a greater risk of functional impairment that includes disability or being dependent on others, to become increased risk to become hospitalized, with worse outcomes with hospitalizations and including dependency, as well as increased risk of death. It's a clinical observation, so it's defined to be as chronic progressive condition with a spectrum of severity. The most severely frail older adults appear to be in an irreversible and pre-death phase within 6 to 12 months of high mortality rate. Earlier phases can be responsive to treatment, and this is why we would like to screen for it and early identify it, and be able to prevent it and its manifestations. There are two types of frailties. The primary one, which results from the intrinsic aging process, and the secondary one, which is resulting from one or more chronic diseases. All frailty theories suggest that it involves increased vulnerability to adverse outcomes, which of course happens in the face of stressors, regardless, either an acute on top of chronic illness or hospitalization or fall. Regardless of the cause, frail older adults have decreased reserve to compensate for and overcome these stressors. Aggregate loss of physiologic function is the process thought to be the underlying high risk of adverse outcomes. An emerging research, there's a research agenda is focusing now to early identify the physiological and the physiology of the vulnerable people before it becomes like phenotypically and clinically apparent on the patients. So it's an outcome of a number of likely unrelated abnormal health conditions in an individual. The being having multi-morbid stage means increased risk of mortality and disability, and the number of a number of conditions that predict this vulnerability. So it's a distinct physiologic syndrome resulting from the dysregulation of multiple systems. And all of these systems interact together to decrease the ability to maintain the homeostasis in face of stressors, resulting in the vulnerability to adverse outcomes. According to the concept of frailty, there are multiple clinical manifestations that affect the strength, balance, motor processing, nutrition, endurance, physical activity, mobility, and possibly cognition. And also, there's like this diagram that shows to us like how it's like a vicious circle for that. Like the patient has a disease or a high-risk environment or taking medication that lead to chronic undernutrition. And this chronic undernutrition on top of other diseases and age-related physiology lead to sarcopenia and weight loss. And this sarcopenia and weight loss lead to other factors, including like decreased resting metabolic rate, decreased insulin sensitivity and increased resistance, osteopenia, decreased LVO2 and maximum exhaustion, and decreased strength and power, leading to impaired balance, increased risk of falls and injuries, increased risk of immobilization, accordingly disability, which also results from decreased walking speed, and also that pulls into dependency. All that will sum up to decreased activity and increased risk of anorexia, also called anorexia for aging, and decreased total energy expenditure, which lead to, again, to our starting point of chronic undernutrition, and the cycle goes on. What's the criteria for frailty? Weight loss increased more than 10 pounds unintentional during the last year. The patient would come in the clinic presenting to us like he lost weight without any kind of intention or following a special regimens or diets to lose weight, and this more than 10 pounds. The patient mentions that they exert effort with everything they do, or they can do things going, particularly within the recent weeks. Increased time to walk 15 feet, and this varies from according to gender and height. And the patient expends less than 27 to 170 kilocalories per week, and this like it has its own specific calculations. Also, the patient mentions that they have a weaker grip strength, and this usually also can be tested using a dynamometer. And also, if anybody is interested to check this reference for more information and more details. Okay, so research has shown that this construct or this structure and this presentation is the clinical or the early clinical syndrome that's chronic and progressive. Early stages generally predict progression to more severe frailty, but frailty can improve particularly in early stages. The earlier we detect it and the earlier we can manage it and prevent it, the better outcome for the patients, because if it progresses, sometimes it cannot be as responsive to treatment and intervention. As again, it can be in early stages, it's responsive to treatment and intervention. And the first manifestation, as mentioned, is weakness, slowed walking speed, and decreased physical activities. And patient, okay, there's like a huge differential for that, but this is like this combination together, this syndrome together, it's highly suggestive in the geriatric population to frailty. Again, we have the clinical presentation of sarcopenia and weight loss, decreased strength, increased exhaustion, and decreased exercise tolerance, decreased motor performance that's manifested by slow walking, decreased physical activities, this will pull to increased physiologic vulnerability and physiologic dysregulation, and also cellular function and molecular and genetic characteristics. What do we mean by sarcopenia? Sarcopenia means the loss of lean body mass, and is a central component of the frailty, and is a key predictor of the other clinical manifestations. Other predictors for sarcopenia and loss of strength with aging include decreased anabolic factors such as testosterone and insulin growth factor 1, diminished physical activity, reduced nutritional intake like protein, decrease in terms of caloric intake, vitamin D and other micronutrients, and the age itself, being an elderly, is also another predictor for the sarcopenia and frailty. Although the fundamental underlying cause for frailty is still unknown, we cannot know what is the specific reason for that to treat, but there are other factors and other intermediate processes appear to entail the dysregulation of inflammation, which is seen by increased interleukin-6 and CRP, decreased immune function, increased anemia, increased glucose intolerance and insulin resistance, low levels of DHEAS and insulin growth factor 1, increased cortisol and low testosterone, decreased heart rate variability, and nutritional derangement. And as the number increases, the stronger the predictor of the syndrome of frailty than dysfunction in any of the other system. A variety of primary diseases is independently predict development of frailty phenotype, potentially through inflammation and or their effect on cardiopulmonary function and inactivity, such as immune disorders, the HIV and AIDS, heart failure, COPD, chronic infections such as cytomegalovirus and tuberculosis. How can we screen for the patients? We need to identify first those at risk for adverse outcomes, gauge the severity of risks, find those who may benefit from prevention or treatment. Is the patient is in the early stages of the frailty and he can respond to treatment, or it's an end stage and mostly poor prognosis? Track changes in the status over time, determine eligibility for palliative care for those at end stage. The cumulative number of symptoms, signs, illnesses, and disabilities present is useful to characterize the aggregate morbidity burden. What are the ways to assess frailty? Again, according to the phenotypic frailty that we discussed earlier, and through rapid screening tests and assessments to be such as interview-based frail scale, clinical global impression of change in physical frailty. This is for the clinical part of it, or we call it other name called gestalt, walking speed or grip strength. This is one of the early manifestations of the frailty syndrome. And then we, according to the results, we proceed to comprehensive geriatric assessment and management, and it's designed to optimize the outcome for frail older adults, particularly to preserve their independence. It's team-based and a multidisciplinary approach, and has positive effect, particularly that the geriatric population has their own challenges of polypharmacy, increased risk of falls, they have their decreased functional status, they might need nursing home admission, all that to help reduce the mortality as possible. And it should be coupled with accurate screening for frailty and ongoing expert geriatric care. The focus of care should be to exclude any modifiable precipitating causes of frailty, including that the treatable or environmental. They should be managed. Improve the clinical manifestations of frailty, such as especially the low physical activity, the low strength, the low exercise tolerance, the poor nutrition, all that to minimize the consequences of vulnerability, whether it's in terms of environmental risk, risks from low social support, risks from stressors such as the acute illnesses or injury or hospitalization or surgery. The approaches that older adults use to adapt to age-related psychosocial losses and behaviors can be also applied to frailty, meaning carefully to choose the goals, optimize the ability needed to reach these goals, compensate for diminished competencies by increased reliance on other functions or by replacement. Clinical management should include such approaches for care of frail older adults, as well as more standard medical approaches. Also, exposure to any of to any of a variety of stressors appears to put frail older adults at risk of adverse outcomes and potentially to participate frailty in those already at risk. The key potential participants are immobility. The immobility accelerate the onset of dependency. Depression. Depression is always associated with decreased activity, decreased energy, decreased nutritional intake, increased risk of inflammation, and social isolation, and appears to be an outcome, also another thing, it will be an outcome of frailty as well as a participant, okay, particularly that like leading to hospitalization and surgery. So we need to pay attention to these participants to minimize them, and of course the stresses associated with them. Also, in terms for replacing deficiencies of any hormones, there was no like any kind of variable like evidence of benefit to give them like hormonal replacements. For example, if they have low testosterone, does giving them testosterone for treatment, or they ask for treatment, does it improve the outcomes? There's no evidence yet for that. As well, the number of deficits in multiple physiologic systems most strongly predict frailty rather than the presence of any other deficit alone. Future effective drug treatments will likely be those that target multiple systems simultaneously together. Along with comprehensive geriatric assessment and management, it has been shown that decreasing the polypharmacy and the related adverse effect of the medications also might benefit for the frail older adults. Also, another benefit for maintaining physical activities and muscle mass is critical for older adults at high risk of frailty, and that includes like resistance training or strength exercises is also effective to increase the lean muscle mass, to increase and improve the strength and the walking speed for the frail older adults. Also, like stretching, tai chi, aerobic exercises can be helpful. What the main target is and the main goal is to prevent immobility. Also, consumption of Mediterranean diet has been shown to lower the risk of becoming frail over 6 years in like the community dwelling adults more than 65 years old. Also, we need to pay attention to prevent nutritional inadequacy, particularly if in terms for protein, calories intake, and micronutrients. The patients might need to take supplements for that. In many studies, nutritional supplements appear to be effective when added to exercise. Like it's not one or the other, it's both together, simultaneously together. There's a term, failure to thrive. We usually are familiar with that for the pediatric population, but also can be added or applied for the geriatric population, particularly in the end stages of the frailty. Some experts have concerns about this term because it doesn't give like a thoughtful evaluation for that. Some argue that it can be used to describe the delayed development, as mentioned earlier, but it might also, for the geriatric population, it might overlap with the very severe and end-stage frailty. So like it might be familiar of anybody like can get like the term for failure to thrive and can be like have a similar meaning for having a very severe or end-stage or advanced frailty. Again, frailty predicts the functional decline and onset and progression of dependency at the end of life. Severe frailty with a score of 4 to 5 and metabolic abnormalities of low cholesterol and albumin predict high short-term mortality rates in the frail older adult. Clinical cases suggest a poor response to treatment in the end-stage frailty. It might be appropriate to consider palliative approaches for these patients. So this is like a quick summary. It's a clinical syndrome of dysregulated energetics with definable clinical manifestations that become apparent when physiologic dysregulation reaches a critical threshold and with recognizable causes at the level of both altered physiology and potentially altered genetic, cellular, and molecular process. Also, a validated frailty syndrome is manifested when there is like three or more 5 phenotypic components, which are weakness, slowed walking speed, low physical activity, low energy and exhaustion, and weight loss. Frail patients are at high risk of adverse clinical outcomes, including falls, disability and dependency, and mortality. Frailty develops along a continuum of severity, likely including latent phase that's not clinically apparent in the absence of stressors, early stages like most responsive to intervention, and late end stages are high risk of short-term mortality. The most effective preventive approach appeared to maintain the muscle mass and strength along with eating the Mediterranean diet. So we have a case, but I'll change the scene for that because there's some sort of like the notes I would like to share it with you. So we have a case and participation is highly encouraged. An 80-year-old woman is admitted to the hospital for treatment of uncontrolled hypertension. She describes long-standing fatigue and poor energy. She has a history of heart disease, lung disease, aortic aneurysm, which was noted to have increased in size according to the routine screening. She lost 3 kilograms, which is 6.6 pounds during the last year. Upon examination on her third hospital day, her heart rate is 60 beats per minute. The blood pressure is 160/70. The body mass index is 18 kilograms per meter square. She has difficulty rising from the chair. Her gait is slow. Which of the following does her frailty put her at increased risk during hospital stay? Extended length of stay, admission to the ICU, exacerbation of heart failure, higher mortality.
D.
A.
A. Extended length of stay.
I'd say A.
A.
Okay.
Say
A. Okay.
A.
Answer is D, higher mortality.
B. Okay. D. Okay.
D. Higher mortality.
D. Okay. D. Okay. So let's check it together.
I'll go with the B.
B. Okay.
Yes.
So the answer is D. So thank you everyone for participating in answering the question. And so the answer is D. I would like just to quickly read the explanations in the notes section. So let me move it up. I'll read just like the first few sentences. This patient is frail because she is weak. She lost weight and she has poor energy and slow gait. Frailty is a risk factor for several adverse outcomes during the hospital stay that includes functional decline, falls, pressure ulcers, and delirium. Also, frailty is associated with a higher risk of mortality during and after hospital stay. Okay, so this is why they picked answer D. The next question. Which of the following is the most effective frailty screen for use in the clinical practice? Self-reported health, gait speed, polypharmacy, assessment by general practitioner.
B. Gait speed.
B.
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 D.
D. Okay.
B.
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 B. B.
D. Again, David.
D again. D. Okay, so there is like we are like there's two teams between B and D. So the answer is B. Thank you everyone for answering the question, being active. So the answer is B. Let's read the explanation for that together. Neither of the established models of frailty, such as the cardiovascular health study phenotype model or Canadian study of health and aging cumulative deficit, are suitable for use in an office setting. In an effort to identify a simple, easily interpreted test for frailty, with high sensitivity and specificity in an office setting, the diagnostic accuracy of 7 screening models was compared against established models. The models were reported gait speed, health, self-reported health, gait speed, polypharmacy, general practitioner assessment. Gait speed, okay, and the timed up and go test demonstrate high sensitivity and moderate specificity for identifying frailty, whereas self-reported health, clinical assessment by general practitioner, polypharmacy, and the GFI are notably less accurate. So they are all can be applied for the screening for frailty, but the gait speed has higher sensitivity and moderate specificity compared to the other elements for the assessment for the screening. So let's go to the next question. Which of the following interventions is not endorsed by a consensus of experts regarding treatment for physical frailty? Calorie and protein supplements, hormone supplementation, vitamin D supplementation, reduction in polypharmacy. And I just would like to check, it's not endorsed. Okay.
B.
Hormonal. B.
Yes, yes, B, as you mentioned before. Yes.
B.
Yes, B. Okay, thank you for the answer. Okay. Okay, we all did it right. Hormone supplement. Congratulations, everyone, and thank you for participating. Most studies have been small or lack evidence that hormone therapy is associated with improvement in overall frailty. There's some evidence to support the following as have some efficacy in treatment of frailty, such as exercise, both strength, resistance and aerobic, caloric and protein support, vitamin D supplementation, reduction of polypharmacy. And thank you all for your attention and participating in answering the questions. And that's it for reviewing the frailty. And thank you all.
Thank you very much.
Thank you.
Thank you so much, Dr.
Thank you,
Sarah,
Dr.
for the great presentation. And thanks for sharing and doing great work.
Thank you.
Thank you, Dr. Sarah. It was a nice presentation. It's very, very informative. If no one has a question, we can go to the next topic. It will be presented by Dr. Abdullah. It's about research question. So go ahead, sir.
Before that, can I just share with you? So the frailty is important topic in older adults, and many factors as mentioned in the presentation just now. But I want to let you know that you can apply the same concept not only to your patients in the future, but also to your families now or loved ones like your parents, grandparents, uncles, aunts, so forth. So one of the factors we mentioned to our patient is that laying in bed for a long time is not a good thing, especially when they go to the hospital. Nowadays, we encourage patients to get out of bed at the hospital. And you can see that when you round, the nursing staff or therapists will ask the patient to walk down the hallway for some time during the day, maybe a couple of times, just to minimize the bad effect or the effect of bed rest for a long time. And the reason is that when patients are laying in bed for, let's say, a week, they will have some weakness in their, especially their muscles, lower extremity muscles, and that will affect their gait. That will increase the risk of falling. So if they spend 1 week, we call it they go into decompensation or deconditioning. So that by itself will put them at a higher risk. So let's say they went to the hospitals to the hospital with pneumonia. You give them antibiotics, but you encourage them to get out of bed. You don't want them to be in bed for the week if they spend the week at the hospital. Because if they do, then they will have high risk for falling. If they fall, they will have more complications. And then this same concept you want to apply to your family members or loved one. Try to encourage them to walk, get out of bed, even if they are sick. You can treat them with antibiotics, with IV, with whatever, but still you want them to be active, because the longer they stay in rest, the higher the chance they will end up with deconditioning and risk of weakness and falls. Here, if you want, you can jump in. Let me just show you this. This is the time up and go test that can be applied at the in the office when you have your annual physical exam for older adults. What we do is we ask the patient to sit in a chair and then ask them, while timing that, to get up of that chair and then walk a distance and then come back. It's like 10 feet. And you can be beside them to make sure they are not falling down, and then come back and sit on the chair. So you time that. This video is very fast, just for I forward it very fast for you guys. But usually they walk slower than that. And you time that, and it's kind of like cut off 20 seconds or so. If more, then they are high risk of falling and high risk for frailty. If 12 or less, that means they are good. Mihir, go ahead.
Hello, Dr. Nadir.
Thank you.
So just wanted to add a little bit in that timed up and go test. Usually, as when we do the assessment, we first do the trial with a normal speed, regular speed. But what we look for is their fastest speed to make sure that they don't lose any balance. And then we the time we collect, that's what we go through. So when patient they perform the test, they were instructed that first one will be the normal pace and second one will be the fast pace. And it's roughly as you said, and as you like demonstrated here, that most likely the 10 feet, or to be accurate, it is 9.8 feet or 3 meters. And in community dwelling older population, the cutoff time is 12 seconds. And in the more frail or more older people or people in the nursing home or institutional, is cutoff time, as you said, 20 seconds. And a few more things I would like to share with all of you about frailty. That most important strong predictor of frailty is, I mean, from our physical therapy prospect, is stair climb and sit to stand transfer. They can distinguish between non-frailty and frailty. And frailty is also, as it was informed in the slides earlier, that is also associated with a greater risk of fracture, disability, and falls in women 55 plus. And I also have some references also I can share here, but as it was instructed in the slides, that meta-analysis, one of the meta-analysis I was reading through, it showed exercise increase gait speed, improve balance and performance of ADL in frail older adults. And I don't know if you guys familiar with 1 rep max, which we actually assess their ability to perform the exercise. So 80% resistance given to 1 rep max, that significantly increase the strength in very old population or more in the frail persons.
Thank you so much, and you can share with the chat box.
Yeah, I will add the reference here. Yes, thank you.
Yeah. Thank you so much for the addition. Any other questions or comments before we go to the next presentation?
I have a question, Dr. Nader.
Yes, go ahead.
So
Sure.
movement is always recommended for this population. Should it be like active movement, or passive movement is acceptable to like a physical therapy or so?
So I will let Meher jump in. Go ahead.
Sure. I appreciate about the question. Typically, as a physical therapist, we assess the overall condition, and we assess what are the contributing factors to it, and we treat symptom wise. It depends upon whether the person is bed bound, wheelchair bound, or somewhat mobile. If person is somewhat mobile, then we can, because patient is somewhat active, so may not be restricted, may not be limited by the other muscles or other impairments, so they can do more activities like activities in standing, moving, some slow gait speeds like that. And we can also, if somebody is bed bound and if they have no active movements maybe because of the chronic contractures, joint contractures or muscle contractures or any other deformity, then passive mobility is very helpful.
Excellent. Thank you so much.
I answer you. Thank you. Thank you.
Yeah, so we look at what's the reason, what's the cause, what's the diagnosis. Let's say a patient with CVA or arthritis or falls because of weakness, as we said, maybe because of the condition. So you put that in mind, what's the reason? And the other part, you think about what the risk if they are active. Let's say we want them to walk. We don't want them to walk and fall. So you balance these two, and then as Meher mentioned, we will do the evaluation and see what's the best for them and take it step by step to go to the goal that we think they can achieve. Sometimes they go up, up, up to reach that goal. Sometimes they go to the mid and then they plateau. Sometimes they cannot do that. So it's kind of, you just individualize the plan for each patient. Thank you.
Thank you.
Excellent. If no other question, Sarah Shafia. Go ahead.
Yes, so earlier, Sarah, she presented in her presentation, she mentioned failure to thrive in the elderly. And I'm wondering if this is actually, can it be like reversible? Because it seems to me like it's like one of the end stages of when an elderly patient is like going towards their death, basically. So I'm just wondering, like, because I know that you can reverse frailty itself, but failure to thrive is usually due to a disease and stuff like that. So I'm just wondering if it's reversible itself.
So good question. Thank you so much, Sarah. So basically, again, you want to identify the cause. Failure to thrive in general, yes, it's a decline way or the progression. But if you identify a cause that preventable or fixable, or you can change the course, let's say a patient with CVA, we know most of them will have some component of depression. So if you identify that the patient has failure to thrive and they had a CVA, you want to rule out depression. If there is any component of that, you want to treat that. So if you encourage them, if you treat them with antidepressant, for instance, then there might be a chance that you fix one of the underlying cause for failure to thrive. And if you do that, hopefully you can reverse the course. So again, the main question is what the underlying cause and how can we modify that? If we can, then we can change the course. If we cannot, then we expect that to go down the road and expect their outcome in most cases, as you mentioned. Thank you.
Thank you, Dr. Nadir.
You're welcome.
Hello, Dr. Nadir.
Yes, go ahead.
Sorry to interfere. I just want to add something more about a failure to thrive. And in our nursing home, we see that a lot. So, and it's not just associated with frailty, but it's with many comorbidities when they make patient more dependent on any ADLs or any activity of daily living. That affects their, as you said, it affects their mental health for sure, and increase the depression. Most oftentimes we actually recommend those kind of population or patient when they discharge from our nursing home, or when they actually go to home. We recommend community programs for their more engagement. Senior community programs, there are a lot of available here in United States, like YMCA does that. And there's another one called PACE program, which is actually regulated by Medicaid. And that is also very helpful for them to have more engagement, more socialization, to do more activities. So that somewhat treats their adult or any like a form of failure to thrive.
Sounds good. Thank you so much.
Thank you.
Yes, thank you, Sarah, for the question. And we can move to the next section. All right, in that. Thank you.
Hello, everyone. Hello, Dr. Nadir. And thank you, Tahani, for being the leadership or the leader for the Brown team for next month. And today I'm going to present the research questions. Just I'm going to share my screen. Just let me know if everybody can see this.
Yes.
Yeah. Okay. The research questions, actually, this is the first step to conduct the research. And today we're gonna go through step by steps and know exactly how we can create strong research questions. And first of all, we have 5 steps to develop a strong research questions. First of all, that you have to choose a broad topics, and you have to put like big ideas in your brain. For example, so you wanted to do topics regarding the stroke, then this is the main idea or the big topics. And the second steps, you have to do some preliminary readings to the topics, either by searching the literature review or go to the website like PubMed or Cochrane libraries or anything to try to collect as much as you can and more information about your topics. And you have a big ideas or great ideas, what you how you can formulate the research question. And then the third steps, which is you have to narrow down to a specific niche or scoping your question, your research questions. For examples, if you are, as we said, the big topics is the stroke, then you narrow it down by the target, by focusing on the target population, like for example, geriatric populations. And also, for example, you can search about during the COVID, how the strokes is going on, and if it's increasing after the COVID vaccine, for example, or the COVID infection itself. And then when you found the gap or any problems in the research, or some topics is not focusing more, then here you can start by identifying the research problems or try to fill this gap. And the last steps, which is to write your research questions. And now in the next steps, we can see here, this is actually we have many methods or methodology to form our research. And according to methodologies that you are interested to do, we can formulate the research questions. And the first of all, we have 4 actually designs for research questions. First of all is causal, correlations, descriptive, and exploratory. Now we're gonna talk about each research questions design or methodology separately. We have here the causal research question. Yes, here we can see its implicated codes, and the effect is focused more on the implications, cause, and the effect. And the example, it's like in this, if you wanted to form the causal research, then this is the example for the questions, like how does the classroom temperature influence the student attention span? Or you can rephrase these questions like, or what is the effect of the classroom temperature on the student's attention span? In each question here, you wanted to know if the classroom temperature can be the cause of decreasing this or increasing the attention span or not. The second things, which is the correlations research questions, and this is actually focused, or it's not distinguished between the causal and the effect, but focusing more in the relationship and correlations between or among the variable. And the example for this question, like what is the relationship between the healthcare commitment and the patient satisfactions? Last thing here, we have a descriptive research question, and this is actually aims at describing a certain subject matter with a higher degree of the accuracy or precision, or also to providing a more detailed descriptions of the subject. And the example, what is the current level of the employee satisfaction in the hospital? And actually in this kind of research, we cannot have more answers. So we try to conduct it more with the quantitative. And sometimes we can use the qualitative research, which is going to be less descriptive, but more exploratory. And then next slides, we can describe the exploratory in details. Regarding the exploratory here, is mostly is qualitative, and now we explore unknown perspectives like information factors using open-end questions, not the quantitative. And in this kind of research, usually we don't have enough information, or we cannot expect what we gonna find. So just we try to answer big questions, and most of the times you try to make interviews with a physician, for example, and try to talk to them and ask them and understand the answers. And the example of these questions, like how do the physician adapt their own behavior in response to an increasingly adverse patients populations. So here, the qualitative versus the quantitative research, and this is the pros and cons. The qualitative research here, the advantage, usually answer any exploratory or why questions, like enable the flexible discourse and provide face-and-face non-verbal indicators. But as we said here, usually we cannot go and interview many of physicians or many patients. So usually, relatively, it will be a small number, or it's gonna the data actually it's gonna be very small. And in the quantitative research advantage, here it's usually answer the questions such as how much or how many, provide more decision-making substance confirmation, and this is actually very statistically significant. And the quantitative research disadvantage here, usually generally more expensive and time consuming, because we can go through many data. And also we have a fixed questionnaire structures, because, for example, if you wanted to do a survey, then we give the answer and we give the choices, and the physician or the patient should answer from these questions. We don't have, for example, in this qualitative where we can use the open-end questions and each one can answer whatever they want. Regarding here in the qualitative, the comparison between the qualitative data and quantitative data. In the qualitative data is usually categorical, and the example of these, the gender, the religion, marital status, naive language, social classes, qualification, type of instruction, methods of treatment, and the type of the teaching approach, and problem-solving strategies. While in the quantitative, now here more is numerical, actually numbers like age, height, weight, the incomes, the university size, the group size, whatever. Here, if you want now to form the questions, research questions, we have something called PICO strategies to start doing our research. The PICO, the PICO, the P is the patients or the population that you are interested or your target in this research. The intervention, like what things you want to study, like for example, you want to study the medication for these patients. And the comparator, what is the population who are comparing with, or what is the medication you will compare it with this in your research. And the outcome, what you are expected, from this research to either if it's medication, if this medication is going to decrease the pain, if this medication is going to be effective more than other, and so on. So here we have example where we can apply the PICO strategies. For example, he's like, what is the best treatment for the systolic heart failure? This is just questions, not following the PICO strategy. But if we want to apply this in these questions, first of all, the B, which is the populations, our target is going to be the elder with the systolic heart failure. And the I, we said the intervention, here we would like to study the ACE inhibitor uses for the population who have the systolic heart failure. And the C here, we will compare it with the placebo patients and what the outcome that we are expected, which is to reduce the mortality. So if you want to follow or to reformulate or rephrase these questions to other question, which is follow the PICO questions, it's going to be like, in elder patients with a systolic heart failure, do ACE inhibitor reduce the mortality in comparison to the placebo group or not? So here we have another scenario. Actually, the participation is really appreciated. So we have a 30-year-old female presented with a recurrent UTI for the past eight months. These episodes has been treated with several courses of the antibiotic, but keep recurring. She asked if the recurrence gonna prevented by using the antibiotic or not. Okay. Okay, if anyone can answer, what is the target population here in this scenario?
30-year-old female with recurrent UTI.
Exactly. Thank you for participation. And regarding the I, which is the intervention?
Antibiotics. Antibiotic prophylaxis.
Yes, prophylaxis.
And the antibiotics.
Antibiotics.
Okay, great, actually. And the comparator here?
Placebo. The placebo.
Placebo, exactly, or the patients not using prophylactic antibiotics. And what is the outcome here?
Prevent the recurrence.
Reduce the recurrence.
Prevention of the recurrence.
The UTI.
Great. Then if anyone can formulate the questions following or with the PICO strategy.
Like in the ladies with the childbearing age and recurrent UTIs, does prophylactic antibiotic can prevent further UTI compared to no antibiotic or placebo?
Exactly, actually. Thank you for participation. Yes, here the P for female patients with the recurrent UTI, I, prophylactic antibiotic, C, patient without a prophylactic antibiotic or no intervention, and O, it's decrease the recurrence of the UTI. And the question here is going to be among female patients with the recurrent UTI, do prophylactic antibiotic prevent recurrence comparing to the patient without intervention? So here, if you wanted to, at the end, you formulate your questions and you have a checklist to make sure if this is a good research question or not. First of all, it has to be focused actually in a single problem. And the second thing is going to be researchable, like that means that answer of your questions can be found by collecting the empirical actually data or maybe through existing literatures. The stersing is going to be visible, which is so if it's doable within the certain time or not, or do you have any access to the data you needed, or if it's you have right kind of response or no. This is going to be visible. Specific, actually, all actually the terms you use it in your research question should be have a clear meaning. For example, like instead of using like adolescent, you can use like 10 to 16 years old, and also complex. If your questions actually the answer is going to be yes or no, this is not considered complex. Or if you can find the data very easily, this is also is not considered a complex questions. And the last thing, it has to be relevant. For example, relevant to your field of study or for the society that you are in. At the end, you have to make sure in each research you conducted, you have all your research questions. Sometimes if you have a big research topics, can be formulate a multiple or several research questions, but it's going to be related to same topics. And yes, at the end, just would like to say like good luck for each one for your projects. And just please do remember yourself how far you have come, not just how far you have to go. Thank you. Anyone has any questions?
Thank you so much, Dr. Ala. This is great as well. Excellent presentation and to the point, concise. That's
Thank you, Dr. Ala. Nice presentation. No one has a question. So the next we'll have open discussion about if anyone have any idea about new idea for research project. So if anyone have idea, please raise your hand and share your idea.
I just wanted to ask, are we able to get the slides from Dr. Ala's presentation for future reference?
Sure. Yes, I will send it in the here in the chat box.
I appreciate that. Thank you.
Okay, or you can put it in the app so everyone can find it.
Okay, I will do.
So you'll have an open discussion. Anyone have a new idea about research project? So if so, please raise your hand and share your idea.
So while people are raising their hands, and maybe I can just share with you guys what we have done so far in the last 2 years. So we have some projects starting from case presentation. So we have a case that we thought it might be a unique case. So we did a literature review and then we presented the case in one of the meetings. And then we have different projects regarding patients at the hospital. And with COVID, we focused on certain population, patients with COVID, older population with risk factor, cardiovascular risk, and others. So we have 2 projects going on. We ended up with several poster presentation in different meetings. And then we have other cardiovascular posters, literature review in different topics, and we had one poster about use of assessment of healthcare providers regarding the elder abuse. We had a couple of cases or poster presented regarding the suicidal rate or in older adults and in elder population. That was presented also in an international conference. So all of these posters have been accepted and presented. And one thing we can do for the next step is to convert this poster. Some of them might be a good option to write them as manuscript. So if anyone interested in just starting from from wherever we reach. Let's say someone might be interested in psychiatry. So in that case, maybe they can focus on suicidal. And we have two abstracts. So you can focus on elderly or maybe older adults. And then maybe you can start working on converting this into manuscript. These are just some examples. You can find that in the website for the abstracts. Thank you.
Thank you, Dr. Nadir. I think Dr. Mafaz is raising her hand.
Regarding my research ideas that I would like to share, my ideas were mostly revolved around the effect of COVID-19 and how it affected the patients. So the first one would be the one about how among people who are less than 18 years old, which are pediatric communities, they were found to have increased prevalence of diabetes after their COVID-19 infections, which is very interesting. It was very interesting. And yeah, like is there like, should I ask, like, is there a question about the topic or should I say anything?
Yeah, I think it's a great idea. So, Dr.
Yeah, it's a good idea. So again, if we can follow the same step like Dr. Ala mentioned, the PICO question. So you will focus on the pediatric group. You are targeting the effect of COVID on this population. So what's the next, what you want to do about that? You want to review charts, you want to review the literature, you want to see what's going on, what is in there. And one important question is, when you put your question, make sure if it's answered in the literature or not. Because if someone already come up with the same question and they publish it, there is no need for you to repeat that unless you want to modify that question. And the modification can be done in different steps. One step is looking at the type. Let's say I have an idea about certain things. I will look at the literature and I found that people already published that, but they did it in, let's say, between 2010 to 2015, in that period of time. So for me, I can repeat the same approach, but between 2015 to 2020, or maybe 2020 to 2022, some. So I will do the same question, but different time period. And that can be published, and you can work on that as a project. Second type of modification is the population. So if the population is, let's say, the third question was done in English speaking, we can apply it to Arabic speaking or Spanish speaking, or whatever other group with different language, or the age group. If it was done in adults, we can apply the same concept in older adults, or in your case, maybe children. Location. If the concept was applied in, let's say, Michigan, so we can apply the same concept in New York or in California, let's say, something different location. So you can modify whatever there if it's already done, so that you can get different output in a different setting. But thank you so much, Dr. Mafaz, for your idea. And go ahead, Mihir.
Hello, sorry. So I have a research project idea, and I think Dr. Nadir, we talked before on long COVID, which was kind of impending for a long time, but I would like to definitely work on long COVID rehabilitation in older population, mostly who are institutionalized, so in a nursing home. So, and also like multidisciplinary approach on long COVID.
So sometimes it's a good question, and the project already started, but it's on hold for now. People are busy here and there, but we can restart that. You can lead that if you want. But what happened in the past when we have an idea like similar to what you have, we can involve some of the fellows, and when we get the information, we can get that project divided into two categories, like what you are thinking now, long COVID, one approach, but if you want to add multi-component or interdisciplinary approach, that might be another output for your data. So when you collect all the data, you will see if you want to use it as one project, one proposal, one abstract or paper, or you want to get the data and then divide it into two projects, something like that. So people will be interested in that. Thank you so much.
Thank you.
Yeah, Shaima, and followed by Muhammad with that. Go ahead, Shaima.
I have a question. I don't have access to patients right now, so the only option I will have is to do a literature review, or there's like other opportunities. Thank you.
So this is a great question, and the idea of the fellowship, we want it to be virtual. That means you don't have access more or less to the charts. But what happened in the past, someone came with the idea about COVID and certain question. If your question is applicable to some of the patients that at the hospital where we go to here in Lansing, let's say Sparrow Hospital is a big hospital, there is another hospital, we will see who has access. Let's say one of my friends has access to Sparrow. So we will share with them our question. This is what happened last 2 years. We asked them about COVID and let's say heart diseases and risk factors. And we came up with a variable. So your question will have some data that you want to collect from the chart. This data is supposed to be itemized in a variable format. Let's say I want the age, I want a patient who has positive test with COVID, I want female, male, whatever. I want them to be admitted to the hospital. If you want a certain duration, let's say more than 5 days or 3 days. If you want certain group, let's say ICU patients, something, whatever variables that you want in your question or your study, then you put them down. Comorbidity, common conditions. Let's say you want patients who has hypertension or conscious heart failure or whatever. So you put all this. And then most of the hospitals nowadays, they have their charts electronic. So I don't know if that hospital is paper format is still there. But if you want to go for Sparrow, they have their electronic medical records. So what we have, we can put the question, put the variables, contact the people at the hospital. They have their IRP. We will go through IRP. And if they approve the question and the variables, then we will go to the tech and the technical department where they can just run a query and get all the information in an Excel sheet for you. It's not going to be like we go chart by chart. In the past, you have to open the chart and add the information. If this is accessible through a query, the IT team will bring that information for you. And when you get it in an Excel format or spreadsheet, then you can do the analysis and then you can answer the question or report your findings in the form of abstract or paper. So it's doable. It may take some time, the process itself. It depends on how eager was the question, is it interesting with the variables, and how we can do that. The other option, as you mentioned, we can look at other online accessible data. Some of them might be databases that you can apply the same concept, same question on database there. We have national inpatient database. I think we can buy that and then you can run whatever question you have and get the information from there. Or you can do the literature review, write report about that. Thank you so much.
Thank you, Doctor. And in this case, do we need to go through the process of like the IRB acceptance or approval and this stuff, or
the first
accessing
option,
to data?
the first option, if you are accessing the database from the hospital, yes, you want to go through IFE. If you are just reviewing literature, let's go through the database online. You don't have to do that. You don't have to go through IFE.
Thank you.
That, and then followed by Rowan. Go ahead.
Okay, hi everybody. I guess I came to the meeting a bit late. I'm sorry for that. So I would like to introduce myself. This is Mohammed Maqdad. I have graduated since 2016 and I'm currently working in an internal medicine department, working as a service resident. So I'm really interested in internal medicine, particularly the GI field. And I would like to thank Dr. Nader for giving me this great opportunity to join this valuable group. So my question, Dr. Nader, is there any chance to do a systematic review? Previously, is there any trial by anyone to do a systematic review? Because my question will be about a GI topic, maybe IBD specifically in elderly, and to do a systematic review to compare a treatment for IBD in elderly and to compare it with the adult population. So what do you think?
Sounds good. First of all, welcome and welcome everyone, you and
Thank you.
Seniors as well. So the question, if you apply the same concept what Anna mentioned, put your question, and then we can look at how you want to apply that. If you want to do the systematic review, as I showed you in this couple of posters, they already, the senior fellows in the past couple of months, 2 years, they applied the same method using systematic review, and they published some posters and presented this in conferences. So it's doable, and if you have the area GI, you can apply that. So shoot me an email and we can discuss the next step. And I will hook you up with some of the seniors who did that, so that you can see how they did it, and you can create a team. Whoever interested in internal medicine or GI, they can join you. They can work with you as a team in that project. So I just want to explain things again to the new and the old previous fellows, that we work in teams for the fellowship. So we have 8 teams by colors. This just for the organizational presentation like this on the communication and so forth. It's just to make the fellowship go smoothly. The other division, or we divide you, or it depends on your interest and your time, your availability. So whoever wants to start a project, they can create a team. So that team will be just for the project. So you might have yourself in blue team, but you can join Mohammed Maqdad in his GI project, let's say. And if you are interested in joining Mahir in his long COVID, you can do that if you have time to do more than 2 projects at a time. So just clarification. So most of you can join more than 1 project, but at least we want you to finish 1 project by the end of the year. If you are working hard, you come up with the idea, you can run the team for the project as a project leader, and then you can publish when you publish. At this time, I don't think it's different if you will be the first author, second author, or last author at your stage. We just want your name there, and the program directors of the residency, they want to show, to see that your name is there. They don't care if you are the first author or the last author. When you join the residency, you go through fellowship and faculty position, then your location in the authorship list will be of value at that time. But for now, if I I just want to make sure things clear. Thank you. All right, Rawan Alhaj, followed by Arik.
Hello, everyone, and thank you for the presentations. I'm really interested in neurology, but unfortunately, I don't have any access to patient information. So as you were scrolling down, Dr. Nader, I noticed you have a neurology case report, and I was wondering if I can change it into a manuscript. However, I do need some guidance because I'm not familiar with the process. So I was wondering if you want to change this specific case report into a neurology manuscript, and if there are any other neurology case reports that you are willing to change into manuscripts as well, if it's not this one. And I was also wondering if there are any other fellows here that are actually interested in neurology and have patient access. I can also help with that because I don't have access, so I can do the literature review as the other fellow just mentioned.
Excellent, and welcome. This is a great question, and it's better, as you said, to know what's your interest, and we work on that in different projects. So yeah, again, we can work on turning the abstract into manuscript. So if you are interested, we can share about how we can do the next step as far as writing a manuscript. And again, that can be done in a team format. So let's say there will be a team leader for that, or someone can be a team leader, and then the team will be formed, and then we will work on getting the script divided into tasks. Let's say you will write the first section, introduction, so you will do some literature review, and you will start writing. Some other fellow might be interested in writing the case, so it's already there, but maybe they will just add some addition here and there, and maybe a third fellow will work on writing the conclusion of the next step, the last part of the manuscript. So we will ask them to do that task, and then when you're done, we can search what journal are there that can be interested in the manuscript, and we will submit it and see if it's been accepted. If it's accepted, then it's just write it down and send it. Thank you. Someone interested in neurology, they can work together. This is one thing. Another thing, as far as the data, as I mentioned, there is a national inpatient database that we can try to access. We haven't in the past, but I know some of the other fellowships, cardiology and other areas, they did many projects from the database. So we can also think about that. The last part about neurology, we have a neurology grand round. They do it on Friday mornings, weekly here at Sparrow. It's a combination between Michigan State and Sparrow. If you are interested, shoot me an email. I will give you the link so that you can listen to this grand rounds. And sometimes they follow the grand rounds with cases. So that might be of interest to you as well. Thank you, everyone. Dr. Arich. Yeah.
Hi, everyone. Hi, Dr. Nader. I have two research ideas. The first one, which is what Mufaz said, it is the presentation of COVID-19 in the hospital, other than the respiratory system, mainly just to kind of bring more awareness to physicians that if patients come in, I think I saw like a few literatures about pancreatic necrosis or just acute pancreatitis to actually just check for COVID, because usually that's the presentation. The other one is relationship between cognitive dysfunction and hypocalcemia in the elderly. The reason for this is that cognitive dysfunction is very broad, and there's not a lot of identifiable causes.
So the purpose for this is to kind of try to at least identify, oh, maybe hypocalcemia could be one of the contributes. I don't know if it's a good research idea, but I thought I would just throw it out there.
Thank you so much. So again, the ideas are welcome. And what I suggest is you follow the same concept, but I mentioned that PICO approach. You want to identify if you want to specific area, population, and target, what you want to ask the question. And then depending on your question, what you want to apply that. You want to get information from hospital records or information from the database, the national database, or you want just to build your question about systemic literature review, something that approach. So these are valid questions. So if you want to modify your ideas, make them as good research questions, build the idea, build the project, and then maybe you will have something interested in these areas, and then you can work on that. Let me know, and we can work on that together. Thank you. I showed you an email. Note, please go ahead.
Can you hear me?
Yes, go ahead.
Well, first of all, thank you very much for giving me this opportunity to join the group. I was specifically referred to you, that will increase our chances of having a good research paper. My name is Naud Takaru. I graduated 2015 from Orota School of Medicine in Eritrea. And as I worked for about 4 years as a general physician, and I'm currently residing in the US. And I took USMLE step 1, and I'm currently taking step 2. And I was reviewing a lot of the matching programs. Most of them require at least a minimum research for any international medical graduate. So I was like going through your script down in the scroller, and I see a lot of 2 or 3 papers in psychiatry, which was supposed to be changed into script. So anyone in this group who have first priority of doing that in psychiatry, or preferable also in internal medicine, I'm also into that. And thank you for giving us at least a guide and framework of how to start from there, because I have no idea before research. I knew that I knew to do research, but I have no idea how to do research. So I really appreciate the fact that you give us a time and place to do this. So really appreciate it. Thank you.
Thank you so much, and thanks for sharing, and welcome. So again, if you are interested in all of you in certain areas, GI, psych, or neuro, or other areas, let's work together as teams and see what can be done as far as if you have questions, new projects, or if you want to compare whatever we have as posters, abstract, you want to increase that to change it to manuscript, that would be good. So I mentioned something in the chat for, so maybe you can create subgroups for the interests, and then you can talk together. And again, you can do what happened in one of the group last year. They composed of 10 fellows. They worked into getting a literature review of certain topics. They created all the data, and then they divide themselves into 2 teams. And they finished the projects as 2 output or 2 abstracts, but they put them in both abstracts. So it's kind of teamwork, and it's added to them 2 points with the same amount of work. And this is what we call efficiency. I want to draw your attention that we have a big number of fellows now, and I don't want you to be all in one project. So it doesn't make sense to be 30 in one small project. If you want to be in a project, I assume the cutoff number in each project might be 10 fellows. More than that, if it's an important topic, we can look at like guidelines. When they publish them, they will have 40 authors. That makes sense because it's a guideline. It's a national impact paper. So if the project is very important and broad, we can have more fellows involved. But if it's an idea, a small project, I hope that 10 or less in each project, they can be in the poster. Thank you. Arit or Mayada, you're raising your hands. Okay. Go ahead, Mayada.
Hello, everyone. Thank you for a great presentation. Thank you, Dr. Nader, for this great opportunity. I had an idea for one research regarding chronic musculoskeletal pain associated with sleep quality and sleep disorders. As we know, with aging process associated with poor sleep quality and greater chronic pain prevalence with age-related in brain functions as a potential underlying mechanism. Also, it can be linked with neurology researches as well. As we know, I'm new in research, that's why I need your advice how to arrange this one. And also it's linked with our specialist as a dentist. Yeah, it had a great effect on our TMJ disorders. It really, I'm very interested in this one.
Excellent. Thank you so much for sharing. And again, the idea is great, and it's just how you can formulate a question, how you can think about the next step. You have the question finished as a research question. What data you want to collect? What you want to do? Is it patient chart, database, or literature review? So you want to identify not only the question, but also how you're gonna do the next step as far as what you want to do with that question. And we can work on that. Again, see who is interested in that question, in that area. If there's any project, for instance, you can modify that to be applied to that subspecialty. And then whoever interested in neurology can work with you in that project, and you can take it from there. And thank you for mentioning that we have, as Meher was mentioning, he is a therapist. We have 2 dentists, we have a pharmacist. So all these fellows can work on different projects in their areas of interest or specialties, and they can ask people to join them and work in different projects in these areas. So I see that already some of you are forming WhatsApp group as far as interest, let's say neurology, GI, or other subspecialty, specialty, family medicine, medicine, and you can work on that as groups and identify projects and see who's going to be in the team in each project, and then hopefully we can finish the project and that result. Thank you. Thank you, Mayada. Anything else? Any other questions? Again, one more thing, Mafaz was mentioning that she's interested in pediatric, and in the past we had one fellow, she was also interested in pediatric and she matched. So the fellowship, although it's in geriatrics, but it's in research. So the concept of the steps of doing research, we are here to learn the knowledge and the skills on how to, and that can be applied to any discipline, geriatric, adults, or pediatric. So when you apply for residency, you can mention that you join the residency or the disease fellowship with interest of knowing the basics of the research and doing whatever steps that you need to do to know and to apply the skills that you learned, and it will be helpful for you hopefully when you apply. In general, however, we want you to present yourself when you apply to family medicine or internal medicine or let's say neurology with some products that make sense that you, when you say I'm interested in this, your products will be in line with that. It doesn't make sense when you say I worked in COVID, in older adults, in nursing homes, and then I'm applying for pediatric. All of them doesn't align. Like it's not go in hand. But if you are in a fellowship and you work in a project like Nafaz mentioned in pediatric, and you apply that and you submit it as abstract, and you put it in your resume and you apply to pediatric programs, then it makes sense. If you have project in neurology and you publish that and you apply to neurology, it makes sense. If I'm making sense, you can follow me. Go ahead, Naira.
Yes, Dr. Nader. I actually had a suggestion basically because everyone is posting their numbers in the chat. Is it possible if you could make a WhatsApp group of all the 90 members present so that we can create groups based on specialty from that? Will that be possible?
I think you can make.
Or we should just pick up the numbers from here and just go.
Create a group and send it here.
What do you say? Can you say it again?
Just Dr. Ala create the group. You can send it here in the chat so everyone can join this group. So
okay.
Yeah.
Okay.
One second, I will send it.
Okay. Thank you so much.
Excellent, good question. Any other questions or any other comments?
So Dr. Madi, I have a question. So about the grand rounds on Friday. So how do we join the grand rounds?
So for that, I'm gonna just so when you go to the app, when you log into the app, here's a Zoom meeting. Here's the Zoom meetings previous and upcoming. But if you go scroll down all the way, you will have the Msu Neurology Meetings. So if you click on that, it will have the link for the Friday meetings. Whoever interested in neurology, they can click on that. They start at 7:30 a.m. New York time. And then I think they go until 9-ish or 9:30, I'm not sure. I just spent the first 1 hour or 1.5 hours when they are talking about the neurology in general, and then I leave, and they usually have some cases after that. So whoever interested in neurology, they can stay longer to attend the case presentation. We have also grand round for Spero and MSU in internal medicine, and this happens every 2 weeks, and you can click on the schedule here to see if you want to join. They have the link here also, and they spend, I think they start at noon New York time, and it's 1 hour grand round. So whoever interested in internal medicine, maybe they can join that as well. Thank you. Any other questions?
Dr. Nadine, will we
Yes,
get like letters of recommendation after, like if we attend internal medicine grand rounds or no?
So you are in this fellowship, you're gonna get a letter of recommendation from me, and I hope you finish at least one or you work hard on one project. If you want to do more, that's welcome, and we encourage that, but we know that some people might be busy preparing for step 3 or other applications, but at least we want you to work hard on one project, and you will get a letter of recommendation, at least one. And what I suggest from you guys is you think about your application from now until, let's say, September. We will work on research in this area, but I want you to think about the clinical aspect. If you can join some If you are in the US, there are some free clinic, if you can find some nearby, or in institutions, if you can join them nearby in your area, or as in this case, you can join internal medicine grand round if you have access to family medicine grand round or other, let's say, neurology grand round, that would be great. But if you can do an actual extension or like round with a physician, so that you can have an idea about the clinics or the hospitals, and they can write a letter of recommendation from that rounding with them. That would be of benefit to you as well. You will have the experience, you will have the exposure to EMR, let's say, and you'll have the recommendation letters. And as long as you get more than one from different people, that would be great for your application. Thank you. Good question.
Thank you. And if you allow me, I have another question regarding having the topic of the research with my like interest field. Can I do, like, I'm interested in internal medicine, but I am interested in research field in Alzheimer's disease or neurodegenerative diseases for like personal reasons. Can I still do that, or do you recommend to have like more consistent topic with the field that I'm interested in?
No, Alzheimer or any research in all the others can be applied to, let's say, if you are interested in internal medicine and go for neurology, or family medicine and go to other such specialty. It doesn't matter. I think you can just put your question, as we mentioned, like go for the PICO, if you are interested in the Alzheimer, what's the question exactly? My interest is the relationship between sleep and Alzheimer. If you can find something in that area, and you can specifically down or limit the question to be a doable one, maybe you can start working on that. And then you can get the data, and if you can have a team, they can publish it as an abstract, or if you have time, you can work it as a paper. So Ala wants to join you, so you can both start a team regarding the Alzheimer or dementia in general, and then we can, sorry about that, we can get the all moving in that direction. So
thank you very much. I appreciate your input.
Thank you. Yeah. Monia Haddad, please go ahead.
Yes, hello, Dr. Nader. So I see that you divided us into like subgroups. So my question is, do we have to stick to those groups? I mean, the team to work together, or?
So again, the idea of dividing you guys into teams, it's just for me to make life easier. You make my life easier. I want to make sure all of you are engaged and have the same opportunity to work, and at the same time to coordinate between you and your colleague. And to make that happen, if you are in teams, let's say you are 10, 12 in one team, let's say the blue team, and you have the leader for that team, you can communicate with that leader as far as, oh, I'm going to Sudan, I cannot be accessed next week presentation, so can you allow me to be what we call leave of access, let's say. Then the team leader will not assign tasks to you. He or she will assign tasks to someone else in the team. So next week when we come, your team will be able to, let's say if we want you to present something, your team will be able to do that in a certain manner. So it's just communication and organization and task management as far as working on this fellowship, so that we want this Zoom meeting to be of benefit to all of you, but at the same time, it's an opportunity to participate for all of you. So, if you want to present, you will have the opportunity to present. If you want to work on whatever things you can share, and your team leader will arrange that, and then we will work on that together. If
All right,
there's
thank you.
issues, the team leader will try to manipulate or work around. And then at the same time, down the road, you might be a team leader so that you will gain some skills as far as leadership, and this will be applied in your application. You can mention that to the programs that you apply to, that you work as a team leader, you did this. So if that makes sense. Thank you.
Yes, thank you so much.
Yeah. Shushma, go ahead.
Hi, Dr. Nadir. So I wanted to ask you, you mentioned grand rounds for internal medicine and neurology. Do you have any grand rounds for psychiatry that we can join?
At this time, I don't have access, but I know there is at least one, or I think two of the senior fellows, they have been accepted to programs. So I will be in touch with them, and I can give you their contact, so that if I assume the program they have grand rounds in psychiatry, maybe they can give you the access to join them online.
Thank you, Dr. Nadir.
You're welcome.
I'd appreciate it. Thank you.
Thank you. Good question. And again, if you are interested in any area and we don't have access, and you can find some access, maybe you can share it with us. Let's say Migdat has approached some residents who are working on GI, and they have their GI grand round somewhere. Maybe he can share that as well. Let's say, just for example. Thank you.
Assalamu
Nafisa,
alaikum.
go ahead. Yes. Oh, Miriam, yeah.
Yes, sorry for the interruption.
No, correct.
I have a research idea that I want to know your opinion on it. My research idea is about the misdiagnosis in elderly population and its effect on their lifetime. So how does it sound? Is it a good idea, or?
It's a good idea. And if we want to follow the same steps as Anna mentioned. So the question here, you mentioned you have a general idea about this subject. Let's do literature review. Let's look at Google Scholars or PubMed or other literature there. See if you have, number one, the question formulated, and if that question has been answered, then maybe you don't need to do that question. Or if you have the same question, but you really, really want to do the project on that topic, and they already mentioned it, then see if you can find a way to modify whatever in the literature. As you mentioned, there are ways to modify whatever happened in the literature by date, the duration of time, by location, by, let's say, specialty area, or language area, or the what else? So you can modify things around. If it's only in female, you can look at males. If it's adults, you can look at all the adults, something like that. So
okay. Another question. I looked. I found in the internet that there's only, I believe, 7 publications about this idea. So is that a good thing to have? Like, because I won't have a lot of material to work on. Is it a good thing to have a research idea that has little information on net or little literature review about it? Or I'm supposed to go to?
It's a flip-flop. It's 1 or 2. If you look at it from a question of what we call a gap in literature, that's a good thing. That's a good area that you want to invest and get information. Maybe you can answer the question that you raise or get more information. And to do that, you may want to do, let's say, a questionnaire, or you want to do a chart review or whatever. Then you want to get some answers to the question from what we call a primary source. It's not the literature review. Literature review is a secondary source for your data. So you can go the step of primary source finding data. That's a
Okay.
good thing.
Okay. Okay, thank you.
You're welcome. And Nafisa, go ahead, and then followed by Khalid.
Hello, Dr. Nader. I have a research project, but unfortunately that I checked in PubMed. I didn't see this idea being done before. So I have an access to a healthcare system, and they're willing to help me to start doing this research project. But the only thing that I would like your help, that if you can help me to find other clinic or hospital that I can access their system as well in order to get more data about that.
Excellent. So if you want to shoot me an email, we can work on that. But again, if you want to follow the steps as far as Ala mentioned, what's the question, the research question? Yes, there are a lot of data there, a lot of health systems and hospitals with medical records, electronic format nowadays. But what's exactly the question? This is number one. And number two, what the variables to answer that question? What's the data that we want to collect? If
So-
you're going to look at the chart, you want to check age, you want to, whatever information you want to grab or extract from that chart, what are they? If you have this listed to answer your question or your research question, then we can write that as a project idea, and then the next step will go to, let's say you want to apply that to hospital in New York, and they willing to work with you. They ask you, or they will ask you to go through IRB because you want to go into the chart of patients. So they want to make sure you are not putting this patient at risk. So you go through the process of the IRB, and the IRB will ask you a question. They will ask you what the question and what the variables that you are you are going to get from the chart. Does it make sense?
Yeah, it makes sense. It's a side effect of medication, hadn't been reported before. And myself, I noticed it in the clinic. So I want to do like research why this happened. And we don't know exactly what could be the other factors. So that's what the area of the research, why this is happening and what could be the factors underlying this side effect.
Excellent. In that case, then your other question will be, you're gonna collect some data from chart, what's your
Exactly.
number, what number that makes sense for you. And then if you need more systems, let's say you have a low number, but you want to increase that number, we can work with, let's say if it happens the same here in Lansing, we can try to see if Spare Hospital has the same data, then we will apply for IRB here at Spare Hospital, and then see if they can accept that. We can collect the data. It will be from different centers, let's say in New York and Lansing, something like that.
So, sorry, I have another question. So this, I don't know how that it could work in the hospital, because usually patients in the hospital, they have short stay, right? So when we start medication, we follow in time, and that's usually happen in clinic more than hospital. So I don't know if the hospital access that can help with this data, or it has to be just limited to the outpatient setting.
No, I'm just applying as a concept or as an example.
No, like,
but if your question and your data are purely from clinic and outpatient setting, then again, do they have the data for your N to be of valid? Let's say the clinic, is it small clinic or big system clinic? If it's big and you can get a lot of information from that and you don't need data from other resources, then you can be fine. You can just apply the IRB for that clinic, and then if approved, you can collect the data and work from there. But if, let's say, you are working on a small clinic and your data might not be enough for you to make sense out of it, or then you want to increase that number, then you will think about, hey, maybe we can work on clinics in California, clinics in Texas, or whatever. Then if you can find some other clinics with the same variables, then you can engage this and you can apply to the RFP, the same concept, then just increase your number, if that makes sense. One thing you can think about is the free clinics. There are a lot of free clinics in big areas, big cities. These might be also of, if they have good EMR, then and they are willing to help. These are good resources as well. Thank you.
Thank you so much. Appreciate it.
You're welcome. Khulud, go ahead.
Yes, hi, Dr. Nader. Hello, everyone. Yes, Dr. Nader, how about a research project of impaction of COVID in elderly people before and after receiving the vaccinations? Is that like there's decrease in mortality, in morbidity, what's going on after receiving the vaccination? Can I try to do that research and the project? Is that be a good idea?
Again, it's a good question. And if you want to follow the same concept, so you have the question modified to be specific, and then see if the literature answers that question. If they already have this variable on questions answered, it's up to you. If you want to go further, you can modify whatever in the literature to something that's not done. Let's say if you look at the literature and they already answered the question before and after effect of COVID vaccine on the population. If this population is all the adults in general or in real life, like outside of the hospital, outside of the nursing homes, maybe your question will be the same question, but the population might be in nursing homes residently. Then we will look at data from nursing home residents before and after COVID vaccine, see if there is any decrease or increase or effect.
Any changes, or also I can just to just click also on the booster dose or whatever the variations, so I can adjust the study.
So you can, and then you can modify the study according to what the gap that was not resolved by the previous published work or sort of papers. Yeah. So yeah.
Sounds great. Thank you so much, Dr. Nader.
You're welcome. Thank you. Okay, Yusra, followed by Martin Idris. So we are about the 2 hours mark. If people are in a hurry to do other stuff, that's okay. We are recording this session so they can look at it later. And for those who can stay, please stay. Go ahead, Yusra. I think you're fine. Yeah, go ahead. Alaikum salam.
I was interested in pathology, and I'd like to know what you think and also your guidance. As you said, we need to maybe try to have what the research was choosing maybe to be in the best interest of our field that we would like to apply to. So I'm not sure, but I was thinking maybe if we can try to combine maybe or choose like subject cancer or certain kind of disease among the geriatric community, maybe just to have it in the favor of the specialty that I'd like to apply to. Well, so what do you think?
So a good question. And so in the past, we had maybe one or more fellows who are interested in pathology. And I think one of them matched. One of them worked on a project, I think the data from Sudan. And we created an abstract and we submitted, but unfortunately it hasn't been accepted. I didn't have time to work with her on resubmitting or modifying it and resubmitting. So maybe we can work on that and we can share with you here in a second. So these are the projects in the past 2 years. Some of them are submitted, accepted, presented, and some did not. histopathology of prostate adenocarcinoma in Sudan. This was done by Dr. Sharma Engineer. So we submitted it, but it hasn't been accepted. So maybe we can rework this, and if more people or fellows are interested, maybe we can create a team, lead that team, and see if we can submit it to other the same meeting or different meetings, and see if it can be published. Thank you.
Thank you.
Go ahead. Sorry, your voice is a little bit far away. If you can help us.
Hello, Dr. Nadir, can you hear me?
Yes, I can hear you. Go ahead.
My point is, all we know, we live in the US and we didn't have access to the patient, and we didn't know the regulation to get the patient. So my point is, can we do a review of article and publish it? Say we have an topic in some sort of pediatric patient, like say Parkinson's disease, and in a certain certain complication against, and put some review and some article and review them and publish it. It's okay, or?
Yeah, this is what I said. We have some done in the past few months and last year. You can see here we have one in dementia, one in brain function, vitamin D, and also one music on aging. So all these are literature review or systematic review, and we published them into, I think, the American Medical Association challenge, and then we already also submit them to the Alzheimer's Association annual meeting that will happen next month, I think, or in a couple of months. So it's a good idea and can be done, and we already did that. So you can look at these posters or work, and you can approach the team who did that and see if you want to follow the same concept and apply the same steps. Thank you. Does it make sense? Any other questions or comments? I see no hands beside Holod Motasim. Okay.
Okay, so I think the next agenda will be Dr. Nadir present to show us how to use the Telegeriatric Research Fellowship app and Zoom whiteboard.
Again, thank you so much for the presenters, and can share with you my screen again. So for those who joined this fellowship recently, we have, when you come in, log in, you can join using the button to the Zoom meeting, but also you can look at the upcoming Zoom meeting. And what we usually do is we look at next week presentation or Zoom meeting agenda, and we can set that up. So you can hit the pen, and then you can add whatever information that, let's say, in that team, Lena and Hadil will work on that, and some of the team members will be presenting topics. Let's say Meher will talk about gait impairment, so he will present there. If someone interested in joining the presentation, let's say Meher and that person, they can work on dividing that task between them. So it will be Meher and, let's say, Sarah. Sarah will go there and put her name, and we'll talk to Meher. They will divide. Meher will present the first part, Sarah will present the second part, something like that. And then we can talk about other topics, and then everyone will be interested in doing that from that team. They can put their names here. So the team leader will make sure all these agenda items are set and ready for the team to present next week. Same what we had, what we saw today. So Tahani was leading the team on the Zoom meeting, and then Sarah presented Frailty, followed by Allah presenting this topic, and the topics of the agenda will be here. So this is the first part. If you want to look at previous meeting, you can hit here, and you can look at what happened in the last months or whatever. You can go back and find more information about what we discussed. One thing I can tell you to be efficient as well, you can, when you watch the video, let's say, you will have an option, not here, but if you open it in YouTube, an option of doing it fast. So you can run the same meeting, because most of the meetings will be 2 hours. If you want to run it fast, it will be shorter for you, and you can focus on certain areas if you are interested in, let's say, a tutorial or in the knowledge of something like that. So these are the two items regarding the Zoom meeting. Then these are the videos recorded for either the Zoom meeting themselves, or sometimes we talk about topics, or I find some topics that might be of interest to you guys, and you'll find it somewhere here. So you can, like this, this was talking about how geriatric fellowship application and acceptance to fellowship without residency. So you can look at that, or you can look at all the videos if you hit here. Then you can select certain videos. Let's say you want to work on Excel sheet or Google Sheet, you will find some here. You want to improve your presentation skills, you will have some here. You want to work on residency skill, how to answer questions, how to do interview skills, you will have some, something like that, and research questions, and whatever we have in the past, or some YouTube videos that we collected that might answer the question. And find them here. You can view all the videos, or you can go by categories. We talked about Sparrow, Hospital, Grand Round, MSU, and Neurology Grand Round. These are the main page items, but you can hit here, you can edit your profile. If you want to reach some of the seniors, you will find them here. Other current new fellows will be here. Team leaders will be here. Then you can view the rest here. But if you want to look at ideas or know how to, for example, this is AMA Challenge winner from last year. This is our idea poster, and you can read about it. You can look at the data, or you can review her poster. And sometimes you might have some interviews. She had some interviews, so she answered some questions that might be also of interest. One area I thought might be of interest is AGS, or the American Geriatric Society. Last year, they had some posters presented, and these posters are related to geriatric education. So there is no patient involvement or clinical. In that sense, you don't have to worry about IRB, you don't worry about data in chart or something like that. So, for example, these are talking about palliative care in certain settings. So you go there, how about in nursing home facilities, what they do in education. So the background, the method, and the results and the conclusions. This is how they wrote their idea. And you can modify that if you are interested in this area or whatever topic. Let's say this group presented how they can use animation online for whatever in this setting. So you can look online also, see if you can come up with other tools that can be used to educate patient or teaching and so forth. So this is, if you don't have any idea about what you want to do, these educational posters. I can give you some ideas of maybe you can come up with to help to some new projects. We have AMDA as well. I did not put it in the American Medical Director Association. These are working with long-term subacute rehab in nursing homes. Also, they have their abstracts, and we participate with them. And I think we have 1 or 2 posters presented there, so I can share them later. It will be somewhere here. Then, if you are interested in doing presentation or reading about geriatric medicine, you click here. These are the slides that Sarah was presented from the Frailty slide. You can download that file, or you can get more information from whatever source you have up to date, Google Scholar or other guidelines as far as the topic that you are interested in. So these are the basic slides for you to use for education or for presentation for the group here. Then if you want to know your team members, here are the teams, team leader and team members, then videos files. Let's say Ala wants to share her file. She just mentioned the presentation that people are interested in. So what she can do, she can click here and then add that file. So she will mention that it's how to answer the question or come up with a question and whatever. And then she can upload the file if she wants to add some pictures and make it ready to share with the group. And if she submit, it will be listed in this here, and people can just click on it and download it or share it or review it. These are the things that you can do in the meantime. So what I think, if you are interested in, let's say, geriatric or internal medicine in general, then what you can do, you can become AMDA member. It's free. So you go to AMDA website and you fill some forms and become a member for that organization. The good news about AMDA, most of them, they have state chapter. So you can become also a state chapter. Let's say I live in New York and they have a chapter in New York. Then you can contact New York AMDA group and see if you want to become a volunteer for them. So maybe 1 hour a week, or in 2 weeks, you can just meet with them, or every month, to see how you can help with them. If they want data, you want to help with discussion or whatever, you can do that by joining them, their chapter, for example. And when you put that in your CV, it will show that you are interested in geriatric, you are doing the Telegeriatric fellowship in research, but you also involved in an organization that's dealing with geriatric, and you also volunteer for that organization. So you are hitting more than one part in your application. Same goes for AGS, American Geriatric Society. You can become an E-member. It's free if you want to go to their conference. The membership, I think, $60 or $100. This is another organization, $33 for 1 year, something like that. So Alzheimer Association, you can become, or American Geriatric or American College of Physicians, you can become also something like that. So there are different organizations that you can become a member, and that will be in your resume. But at the same time, it will open a door for you to volunteer or get active with networking in this organization. Maybe you will have some connections there. These are what to do next. As far as event, this is what we think about in the future. So these are in the past what we think about the annual meeting when we want to submit our, let's say, we have a pen poster that was not accepted in AMDA. So what we modified that abstract and we submitted to pen organization. They have their annual meeting. So they accepted that, and we're gonna present that in a few weeks. In 10 days, 11 days actually. So these are things that we think about in the future. We can add more meetings if we, let's say, pathology, and you are interested in supplying or submitting your work to a pathology meeting. We can add a meeting here, and people will know that we can get more information about them, and then teams will work on that. More or less, this about the features that you can use, and we have more other features, but I don't want to keep you here forever. If you have questions, let me know. Thank you.
Thank you, Dr. Nazir, for.
Thank you, Dr. Nadir.
Thank you so much, Dr. Nadir.
Thank you very much.
Thank you so much, Dr. Nadir, and have a good day, all of you.
Thank you, Doctor. Thank you.
Thank you, Dr. Nadir. Thank you so much.
Thank you, Dr. Nadir.
Very much.
Thank you.
Thank you so much, Dr. Nadir.
Thank you, Baba.
Have a good day.
Appreciate it. Thank you so much. Have a great day, guys. Thank you, Dr. Nadir.
Shaza, if you want to stay longer, that.
Mama.
Thank you, Doctor.
Thank you, everyone. Thank you, Tahani. Have a wonderful day.
Thank you, everyone.
Thanks for leading the Zoom meeting, and have a great day, Tahani. Shaza, go ahead if you have a question.
السلام عليكم.
عليكم السلام.
كيف الحال؟
عليكم السلام. الحمد لله بخير.
كل سنة طيبين. actually نحن برانا ولا معنا ناس ثانيين نتكلم انجليزي نتكلم عربي ولا
whichever easier. ما أعرف في تهاني. في محمد، في تهاني، وفي شذا. Go ahead.
Actually, I don't have question right now, but still, you know, I have some research idea, a lot of things, but maybe I can talk about it next week if you don't mind.
So sorry, your name here has an iPhone. Who is this? Sorry.
Now?
Who's talking? No, I'm not بيتكلم. Sorry. Your name.
شذا أنا اللي بتكلم.
Okay, because it's the name up there and then the iPhone here. So go ahead, Shaza. So you have a question? Yeah, go ahead.
No, not really for today. Maybe next week I can. Yeah.
Sure. Yeah. No.
Thank you so much, Dr. Nadir, for all you did for us and for your help and for everything.
You're welcome. Thank you. Thank you so much. Yeah.
Okay, thank you. Have a great day.
I wish you all the best. Have a
See you
wonderful
next week. Thank you.
Thank you. Yeah, thanks.
Assalamu alaikum, Dr. Nadir. I'm Shaza
Alaikum
Mahmoud.
salam. Okay, ahead. Yeah.
I have a repeated question. I
Yes.
think where I can get access to this recording for this lecture.
So again, if you go to the app, when you go to the main here, you can find it somewhere here. This is for last week, and then it will move this way, and we will add today's video will be here, recorded video.
I didn't see the screen. I'm sorry.
Sorry. I didn't share it. So when you go to your app, in the main page, you go down here. This is the last week meeting recording is here. So if you click on that, this is the last week. But for this week, I'll show you. I can just add it right now. So video. So it will show up somewhere here for today's meeting. It will be with the date and duration will be here, if it makes sense for you.
Thank you so much.
You're welcome. Thank you. Anyone else has a question? Go ahead.
Yes, Dr. Nader, only just for like clarification.
Yeah.
Any change in groups? I mean, did you add subgroups or the same groups, just like you add more members?
So yeah, the group, I added the new members. Let's see. You are in which group?
I mean, it will stay the same groups like these colors, and just you add the new members to each one?
Yes. So most of them the same, except I think one or two they change their
colors.
colors. Yeah. So I think one or two they change from the yellow and the blue to other teams. So it's not going to be affected. So I sent you the list, right? Or you can look at the app and see the list of your
Okay,
team.
perfect.
So,
Thank you. Thank you so much.
thank you. No, thank you for your help and really appreciate it.
Thank you so much, Dr. Nader. You are the one doing everything. Thank you so much.
No, thanks for your help. So I appreciate it. Have a wonderful day. Assalamu alaikum. Nafisa, go ahead.
Assalamu alaikum, Dr. Nader. I have another question regarding, I have a research project, but while I was searching, I couldn't find also the similar project being published before. But there's other similar idea. Like, for example, my project regarding Parkinson's disease and anxiety, as the anxiety is the early signs of Parkinson's disease. So what I found in is that the worsening of anxiety in patients with Parkinson's disease, it's not as an early presentation or early signs of Parkinson's disease. So can I use those data in order to support? So yes, I can use those data to support my research, but from where I can get this, or I can just leave it as, for example, a case report instead of research project.
So usually you start with a case report if you think about, let's say, anxiety can happen before Parkinson. And if you are in the clinic and your patient comes with anxiety for 2-3 years, and then all of a sudden started to have the symptoms for Parkinson and diagnose them, then maybe you'll say, oh, this is a case good for presenting as a case presentation, and see if there are more of these cases in the literature. Then you combine these, and as you go along in your practice or other practice, you have found a lot of patients with the same like anxiety before Parkinson. Then you will write an abstract about that. Let's say you will say, in my practice, I found 100 or whatever number, and then in other practice we notice the same. So we will present this as poster. If accepted and people are like, wow, then maybe you can convert that into a manuscript. If you submit that into a paper, then people will say, oh yeah, or maybe they say, oh no, there's no correlation or something like that. From there, you can build up your, let's say, cohort study. We look at patients from the group in Boston, where they have the cardiovascular risk group. They started in the 40s, and you can look at the data and say, oh, we can look at retrospective studies done in this cohort group. We can look at anxiety and Parkinson's disease and see, maybe you can validate your idea. That's an approach. Or you can start from now, and in the future, you'll say every patient who is having anxiety problem, we will look and monitor for symptoms of
Parkinson.
Parkinson.
That's exactly my that's exactly my idea about the paper, because the only thing that I'm afraid of, it's the anxiety is very common, and that could be like, I don't know, is that to be a weak point in the research project? Because there is lots of people having anxiety. It's okay to get Parkinson. So I don't know how I can, like, get away from this point.
Yeah, the main idea for this fellowship, I think, is how can you come up with a product that's doable and presentable within the few coming months, years, before your application or during your application process. If it's a simple thing that we can do, then go for it. If it's a complicated and needs data and it's going to be a long time, then I would disencourage you from doing or going that route. The reason is that because we can come up with many questions, good ideas, but it will take time and it's not going to be of benefit to you for your application, if that makes sense.
Yes.
So
thank you.
Yeah, you're welcome. Excellent. Thank you, Lisa. Go ahead, Brian. Hassan.
Assalamu alaikum, Doctor. So for me, my question is, one of the research topics that I want to look at is health disparities among the elderly. So socioeconomic status, poverty, gender, and how those affected those individuals during COVID. So I want to focus mostly on the marginalized population. My question is, I know that you had mentioned we can do literature reviews because I'm sure there's many with COVID that have been done, but is there an opportunity to collect that in person?
So again, in person, where are you located?
I'm in Kitchener, Ontario, but like I have the ability to, it's not, Michigan is not too far from me, so I don't have a problem in that regards.
Yeah, so here at MSU, we have a clinic, but unfortunately we are understaffed and we use electronic medical record. I'm not sure if we have good data or not, as far as looking at chart and so forth in the clinic setting. If you have connections to other clinics or someone who is willing to collaborate from other big institutes, they have clinic and they have the data, they want someone to collect information on that, that might be an option. And the other option, if they have the data and they can run a query. So again, you will have your question and your variables, what exactly you are looking for, put them and then submit for IRB, and that institution, they can approve that and then you can collect them using their IT. It's going to be faster than looking chart by chart, collecting your information. It might be something doable if you have some people who are to collaborate with you.
Thank you. I appreciate. Do you, sorry, I don't mean to ask many questions, but do you have any connections that you can provide me where I'm able to reach out to them and see if that's a possibility?
Unfortunately, I don't have many connections. I work with our department here. I work with family medicine, but again, I don't think they will be, maybe they will be interested, but I'm not sure about their data. I work with internal medicine. I graduated from internal medicine here. Also, they have clinic, but I'm not sure as well if they have good data.
Okay.
If in the past they have Sudanese residents, I'm not sure if they have one currently. If there is, then a collaboration with them in that sense might be of use.
Yes.
So,
okay, I'll keep that in mind. I appreciate your help. Thank you.
You're welcome. Yeah, no problem. Thank you for the question. Ashwini, go ahead. You have a question?
No, sir, I'm good. Thank you so much. Very informative. Thank you so much.
Thank you so much. I really appreciate it. Anyone else in the group currently have any question or any comments? If not, then we will see you next week, guys. And I really appreciate your time and joining us. Thank you and good luck. Have a wonderful day, night. Assalamu alaikum.
Thank you.
Thank you.